Assalamu alaikum, respected judges and dear audience. Today I'm going to share with you our initial experience with 4th generation multifocal Quintfocal IOLs. So first of all, we'll discuss the basic design of this intraocular lens. It's a hydrophilic acrylic lens with a UV filter, and it has an 11 millimeter overall diameter and a 6 millimeter optic. As we can see, it has a foot plate 4-loop haptic design, and the additional advantages in this IOL is it has additional dioptric powers of 1.6 diopters and 3.2 diopters. We'll discuss the optics of this IOL in the coming slides. So it's from their own brochure, Optivis. We can see the point spread function of these IOLs. From 1st generation to 4th generation, the bifocal IOLs used to have good distribution for far and near, but the intermediate vision was missing in those IOLs. As we can see here, they have this at distance vision, and this is for near vision. So the 2nd generation of IOLs, they covered, it was the trifocal technology, so it covered the intermediate vision as well, but there is this missing zone in between. So the third generation consisted of far to intermediate, but it had a gap between far and intermediate. It had good near and intermediate, but there is a gap in between. So this 4th generation basically, it gives us a good 5 focal points. The Quintfocal basically means 5 focal points. It is a diffractive technology which uses 5 focal points. So we can see it has this extended intermediate and extended near vision incorporated in this design as well. So the optics of the IOL are as shown in the figure. It has a refractive multifocal within the central 1.5 millimeters the vision, and the transition zone in between is diffractive, which covers the far and near foci, and sensitivity for far vision as well. So once mentioned here, this is the, I think the pointer is not showing this. We can see the near one, it's 3.2 diopters, and near intermediate, as I already told, and far intermediate. So it gives us all range of vision, full range of vision from far to near. So the purpose of this Quintfocal IOL implantation after phacoemulsification. The design of the study was, it was a quasi-experimental study, and the study was conducted from August 22 to December 2024 at Equity Eye Center in Wabda Teaching Hospital, Lahore. The sample size was calculated with G power, and it was 20, and routine phaco was performed on all the patients with 2.7 millimeter keratomin incision and a good 5.5 millimeter suboptical rhexis. The follow-up was performed on 1 week, 1 month. So everything in phaco surgery, cataract surgery should be done under vision. So it is a wound-assisted delivery, and the IOL beautifully unfolds, and the leading 2 haptics of the plate haptics go into the bag directly, and the trailing haptics are in the anterior chamber. And then surgeon uses a Simski's hook to place the trailing haptics into the guide them. So the results, some of the results and conclusions of the study. Mainly the patient's age was 50% from 51 to 65 years of age.
Your time is up. Your time is up.
Okay, sir. Okay.
Would you like to continue?
Yes, it was just 30 seconds. And this is the gender distribution, male and female. Okay, these are some of the results. The 70% of the patient had 6/9 or better vision, and 40% of the patient had N8 or better vision, and for intermediate, and for near, 70% of the patient had N8 or better vision. So conclusion is that Quintfocal IOL appears to be a safe economical option for the patients wanting less spectacle dependence for intermediate, near, and far vision needs. So it is a safe and effective option, but to conclude with the limitations of the study, further follow-ups and bigger sample size are required to establish the facts. And the study is ongoing, so quality of life of the patients is also yet to be completed, but dysphotopsia was a common complaint among the patients. Thank you so much for your attention.
Dr. Abdullah, you are in a
Sorry,
hurry.
sir. Any questions?
I wanted to ask, are you doing phacos yourself as well? Are you doing phacoemulsifications yourself as well?
No, not yet, ma'am, but we are doing the steps of the phacosurgery.
So what about the capsular rhexis? Are you doing capsular rhexis in few cases?
Yes, yes, I've done it.
You are doing capsular rhexis.
Yes.
And is it a quantitative study or a qualitative study? Did you take, how did you take the inputs from the patients regarding the intermediate as well as the near vision?
We have a questionnaire as well for the qualitative as well as quantitative study. So as I already said, for the quality of vision and for dysphotopsias, glare and hollows, the study is ongoing. In the near future, we aim to complete it, and we'll have the data of around 50 patients completed by the end of the year, and we'll try to publish it as well, inshallah.
Okay, good.
Thank you.